Yep.
Okay, so last time you were here, yesterday, we talked about some of this stuff, but I want to talk about it again, just kind of as a refresher. But then also, it's really important for what we're going to do moving forward.
Okay.
So the main thing that brought you here again was neck and upper back pain, and it goes kind of into your arm. And then tell me, what have you done with it, like from a treatment standpoint?
Well, last year I had gone to my family doctor, and she referred me on to Dr. Dane Donich.
Yep.
And because she had taken X-rays, had X-rays taken, it showed I had a pinched nerve in my cervical spine.
Correct.
And so he started me on therapy, physical therapy, and for a couple months I went. And it wasn't really changing much. I mean, it felt good, but it didn't change it much. And then they did traction, and then they did, after that he said that he would try the cortisone injections in my spine.
Yeah, I remember we talked all about that. Remember I said that's not really getting to the cause of the issue.
Right.
So I'm going to explain that, and I'm also going to show it to you.
Okay.
So Linda, we also talked about doing blood work. Did you decide anything about that?
I'm gonna hold up on that right now.
Okay.
Okay?
Yeah, that's totally fine.
Why would my, why did that happen to my spine? I mean, I didn't do anything to cause that.
Oh, that's a great question. I'm glad that you asked. So we have these stressors in our life, right? Remember we talked about that. So there's physical. Let me actually start in a different way. There's chemical stressors, so or toxicity stressors, and that can be the water that we are drinking, the food that we eat. If you're eating foods that are not non-GMO, remember we talked about this a little bit. You're getting Roundup, which is called, the scientific name is glyphosate, which is known to cause cancer. It kills your gut bacteria, which is the reason why I was talking about doing your blood work, even though that's not why you came in. That is one of the things that kind of starts to destroy our immune system because it messes with our gut. So we've got this toxicity exposure that messes with our normal flora, our normal environment in our body gets screwed up, and that's part of one of those stressors. So then we also have mental, emotional stress, and that can be your kids, your job, your traffic, I mean, all the things that stress us out. And then there's physical stress. So physical stress happens, is like slips, falls, sports injuries, car accidents, etc., that we think of from a trauma standpoint. But I kind of talked about this a little bit with you yesterday. We spend so much time looking down and doing work in front of us. What kind of work did you work?
Yes, I did for all of my adult life at Barberton Hospital. I was in the family practice residency program. I worked as their program coordinator.
At a desk.
I was at a desk.
And a computer.
At a computer.
That's your answer. So you got this thing called gravity. When you sit, it puts you in a bad position. We lose the normal. So when you're standing, you're more likely, and if you have good energy in your system, you're more likely to be able to keep a good curve in your, which I'm going to show you, a curve in your cervical spine, curve in your mid-back curve. So everything is lined up over your center of gravity. When you lose that, the ability to keep your head over your spine over your center of gravity, it increases stress on the joints and creates weaknesses and causes tension in the muscles, ligaments, and tendons. compresses the disc. Most importantly, it puts stress on your or tension on your spinal cord. So when you have stress and tension on your spinal cord, it actually starts to shut down the energy, slows down the energy that's being produced from your brain and spinal cord and sent through the body. It's like a kink in a garden hose, right? So tension on the spinal cord compounds the problem. That's the neurological component of this. But what happens is, it's just that you're in this position so much and you're looking down so much that it starts going the wrong direction. We're seeing it right now with kids a lot when they're looking down at cell phones and iPads, and you get put in a desk when you're not very old, and so it's this reversal of the cervical curve that creates a bunch of problems that I'm gonna tell you about.
Well, how come I didn't have this pain while I was still working? I've been retired for 3 years now, and it started maybe a year and a half ago.
Yeah,
How come I didn't have it when I was still working?
that's a good question.
Because I have a computer at home and I'm never at it now because I wanted to be away from it, you know, and I was very active, you know, and so why did it happen now?
Those are good. This is good for our training.
Good.
Yeah, thanks a lot. I don't know. The answer is I don't know, but I do know that it's accumulative. So it's just that something happens. It's the straw that breaks the camel's back, so to speak. We talk about like the empty cup versus the full cup, or empty bucket versus the full bucket. So when you have an empty bucket of water, it takes lots of drops of water before that thing overflows. If your bucket is full, it's only one drop of water that causes that thing to overflow. At some point, one drop and it overflows.
Okay.
Does that make sense?
Okay.
So the problem was already there. The issue was already there. It just needed something to push it over the edge so that you were actually made aware of it. It had to get bad enough to really affect the nervous system, and then it shows up. So the truth is, you ever heard the story about the frog? If you put a frog in boiling water, if you just plop the thing into boiling water, it jumps right out of the water. If you boil water slowly, like if it goes into cold water and you warm it up real slow, the frog will actually fry because it doesn't realize that the temperature change happened until it's too late. Same concept. So I want to show you this actually.
Well, do you think, you know how I had my hips replaced, do you think...
Truthfully, we don't need to.
Because they're already done.
But I mean, what actually pushed you over the edge, I don't know. If I asked you lots and lots and lots of questions, I would find out. But like you're saying, just recovering and being in this position, because you're sitting in bed with a pillow behind your neck a lot of times, while you're recovering, that's enough to push you over the edge. I'm going to show you with your X-rays what is actually happening. So when we look at when we look at what your spine should be, it's this side over here on the left, the far left. So this is normal, nice C-shaped curve, good space between the bones, and the bones look healthy. The first thing that happens, and this could happen with the birth process, it could happen as a baby, it could happen as, we don't know when, but you lose normal alignment. That's what the A stands for. Loss of normal alignment in the spine. If you lose normal alignment, like I said, it puts tension and stress and additional pressure on the muscles, ligaments, and tendons, but also on the joints. If that doesn't get fixed, the cartilage, I actually should have written this differently, should be ACB. The cartilage starts to break down. That's when we get disc degeneration, arthritis. That's phase 2. Phase 3, if it goes on long enough, it actually starts to affect the bone, and we'll start seeing bony changes. But we know that if there's bony changes that happen, all of these other things had been in place for a while.
So like if you get bone spurs or something?
Yes, ma'am. That's exactly right. You're very a good example. So we'll look at your X-rays.
Okay.
the cool thing is you'll be able to tell me what's going on.
Oh, really?
Yeah. So let me back up 1 second as a kind of a side note. Those stressors, all of these stressors that we're talking about, do you remember me talking about how that can push you into that fight or flight dominance? That's where your immune system is fired up, your thyroid may not be working as well as it's supposed to. That's the reason why we talk about looking, because your nervous system is going to control when and if that happens. So if it's out of balance and you're spiked into that sympathetic dominance, or your energy in your nervous system is low, these other things start showing up as well. For you today, we're just going to focus on what's happening here with your spine, okay?
Okay.
And if you want to talk about your thyroid and allergy issues as we go along, then that would be great too.
Well, when they removed that pituitary tumor,
Mm-hmm.
and they had to take part of the pituitary,
Okay, so when we look at this, if you look at this picture, the first thing that we talk about is that your spine should be straight.
right?
Your head should be over your tailbone, and there should be a straight line in between.
Right?
What do you see?
Curved. It's
Yes,
curved.
ma'am. That's right.
Is that why my shoulder is lower on, my right shoulder is lower than my left shoulder?
Sure is, and we're looking at this is your right side, so we're looking at you from the back. This is your right side, this is your left side. So yeah, this is supposed to be straight and it's curved. Your hips are really rotated too. Here's your center of your tailbone is over here, right here, where this thing is. If I drew a line straight down from there, that's the center of your pubic bone is over here. It should be over here.
So how did they get out of the line?
Life?
By the way I do something like walk or?
No, I mean, it's just things that have happened over your lifetime. So, like I said, doesn't necessarily mean that it was one thing.
Okay.
And your resiliency to keep it from changing maybe wasn't as good as it should. And that's where we're talking about your nervous system being under stress.
Right, okay.
So if your nervous system is healthy and working well, we don't get these alignment issues.
Okay.
So when we look at this picture, remember we said C-shaped curve in the neck, C-shaped curve in the mid-back, C-shaped curve in the lower back. If you look at your neck first, what do you see with that?
Well, I see the C's in the other places, but I don't see the C up there.
Exactly, Linda. It's actually supposed to be going, it's kind of a C, except it's going the wrong way.
Right, right.
It's supposed to be going this way. And nobody has given you this information before.
No, they just, on the X-rays that they took, they told me what was missing between the vertebrae and stuff. Yeah.
Correct. So what phase do you think you are in?
The last one?
Close.
The next to
Close.
the last one.
Yeah, I mean, it's kind of in between. Because you are getting some bony effects where there's some bone spurs and there's some degeneration between these joints.
Okay.
So it's all the way, it's gone through alignment, it's gone through cartilage, and now it's all the way to affecting the bone.
Okay.
But look, this joint right here is the same age. So it's not just that you're getting older. It's actually because this is where the most stress is from this reverse curve. Remember this? So should be like this. When it reverses, now you're compressing that sucker. Right?
Right.
And so it's smashing the disc, and now it's even affecting the bone. So the body is saying, wait a minute, this is not good. Let's add some calcium here to shore it up. When we look at the lower back, then so you have the curve, except that it's almost like you have too much curve here where your tailbone is kind of tipped this way. So it's at really a pretty sharp angle. So it's pinching in the back and open in the front, which puts uneven stress on the spine.
Okay.
All right, and then last thing I want to show you is this nerve scan, which is like maybe the most important thing that we can do. So if you remember, I think we talked about this, some of these things the first time, but what we're looking at here, this part of the scan is the temperature scan. Okay, so it's measuring temperature on the either side of the skin over the spine.
Okay.
It should be the same on both sides.
Okay.
When you have nerve irritation or inflammation, when the nerve is dysfunctional, it doesn't keep the temperature balanced, and it's warmer on one side than the other.
Okay.
Doesn't matter which side it's warmer on. We really care about the level, that it's warmer on one side or the other.
Okay.
All right. So, red is most severe. Green is, blue or purple or whatever heck color that is second, and then the green is a step below that. So, if you think about this like a breaker box, you see this chart. It's showing you if you have nerve irritation up here in the top of the neck, that controls your autonomic nervous system, your vision and balance and coordination, speech, immune system, digestive system, vagus nerve, which slows down that fight or flight response, which affects your immune function. So all of these different things, and then on this one it talks about all of the different possible symptoms that could be caused by pressure on these nerves. So these are three areas where you have significant stress on the nervous system, on your nervous system.
So why on the left side down here?
The side doesn't mean anything.
Oh, the side doesn't mean. Okay.
No, because it's just measuring whether it's colder, whether the temperature is the same or not.
Okay.
So this side could be cold, this side could be normal, and this side's cold.
Okay.
Or this side could be warmer and this side's normal.
Okay.
I don't know.
Okay.
I just know that it's significantly different on one side than the other.
Okay.
Which means neurological dysfunction. Your nervous system's not able to keep it what it's supposed to be.
Okay.
All right, and then this one is EMG, which means muscle activity, the electrical activity of the muscle. So on this one, a lot of these muscles are actually, they're not overactive or underactive. All these whites are normal. But up here in the middle of your neck, where that curve is going the wrong direction, and at the top of your neck, and then somewhat at the lower, you got major muscle tension and tightness. So the cool thing about this is it all matches up with what's happening with you.
Right.
And then the last one, this is your what we call heart rate variability. And this side, so from here to here is what we call your autonomic activity. That means like the energy in your nervous system. How much power does your nervous system have to heal you or to adapt to different changes in your environment or life or whatever stressors you come in contact with? Do you have the energy to handle them? And so on that note, you're at a 70. Your sympathetic, parasympathetic balance is pretty good. It's fairly well balanced between the two, but your overall energy output is low. Does that make sense? So that gives you an overall, what we call core score. So this is your neural efficiency rating of a 64. If you're in high school, would you like a 64 as a grade?
Yeah.
No. So we want you to be getting better grades than this. Alrighty?
Okay.
So does all of that stuff that I went through with you make sense?
I think so. I think so. Yeah.
So just kind of maybe as a summary,
Uh-huh.
I don't know how your neck got like this,
Okay.
but it's likely there's all of those stressors impacting your resiliency to being sitting in this position allowed the curve in your neck to go in the wrong direction. So the sitting is the stressor that probably enhanced that, looking down at things all the time. But over years, I'm talking like 30 years, 40 years, it started wearing down those joints because there was so much stress on them. And then potentially being, sitting with your head forward is, after the surgeries, is maybe the thing that pushed it over the edge and made it bad enough to show up. But it is a pinched nerve that is causing the problems. And if you don't deal with your spine and what's happening with your spine, try to retrain it, reprogram it, that will never get fixed. All you can do is numb it, which is not what we want to do.
Right.
Make sense?
Right.
Okay, so today's like trial, right? Show and tell. You're gonna do a couple of things. We'll get you adjusted.
Okay.
See how it goes. We're only gonna do a little bit because we don't want to stir up anything too much. We got to take little baby steps with this because it's been going on for a long time.
Okay.
And then like I said, we'll do some warm-up things. We'll get you adjusted, see how that goes, see how you do with it, and then based on that, we'll come up with a plan as far as how often we want to see you, for how long, what we want to do with you when you're here, what your insurance covers, and what your cost would be. So you'll have all that information.
Okay.
Sound good?
Sounds good.
And maybe, I don't get too carried away with it, but maybe you might even feel a little better today. If you don't, that's okay. It just means that it might take a little longer. And if you feel worse, like worse as in just some tightness or soreness, that's good, because then we're starting to reactivate, get these muscles to start doing what they're supposed to do again.
Okay.
Cool?
Okay.
All right. That's it.